welcome to Health Curious Episode 7. Today, I'm speaking with Miss Jackie, who is a teacher in the New York metropolitan area. All right, so let's start with an introduction. Tell me a little bit about yourself.
So my name is Jacqueline. I am a New York City public school teacher for about 19 years. I am a mother to two boys that are in elementary school, and I'm still a student. I'm studying art education.
What has your experience been like dealing with doctor's appointments, hospital trips, healthcare-related issues, etc.?
I think one of my core beliefs in picking a job, it's great to be a teacher because you have health benefits. So that's always been the idea that has kind of grounded me and kept me in this profession for so long. And with these teacher benefits, I feel it is nice that with my job, I'm able to do cancer screenings each year. I think it's like 4 hours is allotted for that. Able to see wonderful doctors. So I feel like healthcare is a luxury in a way. It's also a luxury to be sick. And I feel like teachers also drag themselves in oftentimes when they are not 100%. The COVID time period was an interesting one. I think I'm still traumatized by that bit. And just having children of my own that when they do get sick, it's like, oh man, how am I going to juggle that? Because I feel like that when you mentioned the hospital visits, that's been with like my boys more. And but again, I have the luxury of having health insurance that I'm able to take them and not stress too much about what is the bill going to be. And that really is a giant peace of mind.
Yeah. Especially since insurance is so hard these days and not all doctors take insurance, and having those health benefits is definitely feather in your cap. It's a good thing.
No, it's true. And even with New York City, there's like news going on. This might be a side tangent, but they had a partnership with Memorial Sloan Kettering, for cancer care. And just the way the insurance is going, there's talks of it stepping away. And, it's hard for a lot of, people that rely on good health care because it's, you just want to have access to the best doctors, appointments when necessary, and to be able to get treated and be healthy again.
Yeah. What medical experience, good or bad, impacted you the most?
So this one's an interesting question too, because again, Lillian, I'm 45, so I have there's like so much years of health experience. I would probably say, so I had a stillbirth experience in 2012. And
sorry.
Thank you. That was just one of the things. So I was about 24 weeks pregnant. It was my first pregnancy. I live a very healthy lifestyle. The 20-week scan, because again, I was able to go to all these doctor's appointments, was fine. The baby was doing really well. And then my next doctor appointment, which should just have been like a routine check with the Doppler, there was no heartbeat. So then I remember sitting in a room and I'm like, what does that mean? And my doctor said, oh, this means you have to go to the hospital and give birth. And I was like, well, can I be knocked out? I have to be awake for this. And it sounded really, just the whole process. I was like, wow, this is really tough. And after it though, I realized how common it is, but I guess wasn't really spoken of too much. I'm always very open with my medical knowledge and history and things that have happened. So that was a tough thing, but it really, I was very lucky. I delivered at Greenwich Hospital and the nurses there were wonderful. One nurse in particular, she had a similar experience. And at Greenwich, they had a policy of after you delivered, they took pictures of the baby. They had me hold him too. And during this time, I'm like, oh, this seems really weird and strange. But they really made this process tangible and a way to grieve after it. Because otherwise sometimes you could be like, well, that wasn't real. That didn't happen. A lot of people would say then, well, at least, it wasn't, you didn't deliver at like 9 months, and I'm like, well, losing a child at any stage is kind of tough, but but the doctors were wonderful. And after that, I was really close with my gynecologist and obstetrician. And I feel like we kind of, I don't want to say trauma bonded, but I know she saw me in a way like, her job is to bring these babies into the world. And I grew really close with her. So
Yeah.
it was a tough experience, and you probably have to edit it. I usually call it a beautifully effed up moment in life. Like, it was a very human experience to give birth. It's like birth and death at the same moment. But it really was the people that came together, and the medical staff was wonderful.
That's
So that
amazing.
was probably the pivotal moment. I had a hard time getting pregnant after that. And so that's why I feel like a lot, I did have to go to a fertility clinic. Even prior to that, I did acupuncture, different things. I think the level of stress after that moment probably prevented. I had a miscarriage between that. And then from the fertility clinic, I had my son, my oldest son, who's now almost 10. But for that point, for him, I had to be on bed rest for about from 17 weeks until 37 weeks. And then I had him at 39 weeks. But I took that very seriously. And again, I was very fortunate to have my doctor, who I loved. And she said she knew the mental challenge of that, because for me, it wasn't fun to be pregnant afterwards. It was just really scary. And even truly now, not many people know this. It's hard for me to see pregnant people and be happy. I'm very protective, and yeah, it is tough. I'm like, oh God, I just want this baby, I want their baby to come, as healthy as possible.
So how's this experience impacted you?
In many ways, I feel like I advocate more for reproductive health, being able to go to clinics if people want to have a baby, and whether it's IVF, IUI, but also beside reproductive health kind of everywhere, in terms of abortion rights as well. Because I did have an abortion a number of years ago after this. And that was a choice that I was glad that I was able to make for my own health. And especially living in New York, it is nice to have that access still. Just bodily autonomy. I guess it comes down to that.
What areas of growth within the medical field, whether that be insurance, doctor care, anything, what areas of growth do you think should be implemented based on your experiences?
I guess the healthcare system in general. I guess at the end of the day, I just would like everyone that would be able to get the service that they need in a timely fashion with as low of a cost as possible. And I know that's an ideal, and there's so many challenges. I don't have the answer to how that could be done.
So you mentioned your gynecologist and how you have a close relationship. What qualities do you like or dislike, and what went into choosing them?
So I think my relationship, I'm glad I have a good relationship with my gynecologist. And it really started from my family. I think when I was about 17, my mom did take me to the doctor's office, and that was for my first checkup there. And it wasn't something to be embarrassed about or shamed by. And then I continued when I was in college, when I was sexually active too. At college, there was a Planned Parenthood that was wonderful with birth control options. Being older now, I'm lucky to have a wonderful network of friends. And I found my doctor through my network of friends. I think, again, I know I'm a lucky person because I have wonderful people in my life that we do talk about health, and these aren't taboo things. And, we do give references
Like
to.
being very open about it.
Oh yeah, very much so. So yes. So yeah. But again, like the friend network, it is important. It's very much a privilege to have these people in my life that are a wonderful resource to keep me healthy.
Definitely.
Yeah.
Yeah, because I think the communication aspect of it also, it's like, I think that's how, how you mentioned networking and how people get introduced to these new resources and just good doctors and good
Yeah.
care. So I think the communication is also very important when it comes
I've
to
heard something about like your 5 closest people and how they influence you.
Mhm.
And that's how I've gotten into, other things like, exercise, different types of exercise, meditation, clean eating, is just having these friends that do care about it and we talk about it. And then, it's nice to have that accountability and people support you with it.
Is there anything else you would like to add or share?
No, I know I did talk a lot, especially about my my pregnancies and everything, and that's like especially as an older person, and everything that has happened politically, I feel it's my duty to speak more about my different experiences, and not that anything is right or wrong. It just kind of is, and try to destigmatize different, just different, I guess, destigmatize abortion, destigmatize seeking fertility help and all, and just knowing that there's a lot of challenges. And at the end of the day, I try to be a good support for whoever needs.
That was my interview with Miss Jackie. She has a very interesting story that details her perseverance when being faced with so much trauma. Hearing about her stillbirth and the effect that had on her emotionally was very powerful. I also found her views on different fertility treatments, abortion rights, and how pregnancy-related issues in general should be destigmatized to be very insightful. I would like to commend Miss Jackie for sharing this story. She is very brave. Thank you for listening to Health Curious. If you'd like to subscribe, you can do so on Spotify or YouTube. I hope you'll join me again soon.